I recognize Dr. Ruiz, 5 minutes.
Thank you, Mr. Chairman. I would also like to thank the witnesses for being here today and for the important work you do to improve public health in our country. CDC plays a vital role in protecting Americans from both infectious diseases and chronic illnesses, and we see this in CDC's priorities. Its focus on tackling our nation's mental health crisis and the opioid epidemic, its work to improve maternal health outcomes and ensure children have access to life-saving vaccinations, and its efforts to bolster the nation's readiness and response capacity to protect against future health emergencies. These are all critical functions of the agency that Congress must continue to support. As ranking member of the Select Subcommittee on the Coronavirus Pandemic, I believe it is critical to ensure the strength of our nation's public health and infectious disease workforce, infrastructure, and data to safeguard public health and prevent future public health emergencies. Dr. Walk, can you share how your office supports states and local health departments' readiness and response capacity?
Yes, thank you for that question. I want to say at the beginning that about 80% of our domestic CDC funding actually goes out to state and supports state and local public health. One of the ways that we support state and local health within my Office of Readiness and Response is through the Public Health Emergency Preparedness Program, which is the largest source of federal funding for public health emergency preparedness and actually CDC's largest domestic grant program. Recently, we awarded over $650 million in 2024 to about 62 recipients, which included 50 states, 4 large localities, and 8 U.S. territories and freely associated states. So the FEP program got its start after 9/11, which demonstrated that public health departments lacked those critical systems for effective emergency response. And over the past 2 decades, FEP investments have developed strong public health emergency preparedness programs, including emergency operations centers, this ability that I spoke about to deliver life-saving medical countermeasures, interventions to the public, shots into arms, and also nationwide laboratory and epidemiology surveillance systems. Again, in addition, we really focused on the public health workforce, and that FEP program supports almost 6,000 state and local employees through that for public health and for emergency response.
So what are your priorities moving forward, and how can Congress help you with those?
Again, thank you for that question. You know, we're really focused actually in my office on being able to detect an emerging threat, and whether that threat's an infectious disease or an environmental threat as well, for example. And once we detect that threat, then making sure that CDC and the nation actually can respond in a vigorous way. And one of the ways we do that actually is through supporting those core capabilities. And that's laboratory systems, that's the public health workforce, those are those data monitorization systems that we talked about, and those emergency operations systems, the emergency management systems, both domestically and global. So most of a number of the threats to the U.S. actually are, start overseas or abroad. And so we have over 60 country offices spread around the world that are also working with countries to detect those threats and keep those threats from coming to America's shores.
And so what can Congress do to help you achieve those priorities?
Again, we need sustained funding in order to maintain those core capabilities. We made incredible strides during COVID, but we're at risk of not being able to sustain those data monitorization improvements, for example, or the public health workforce that were hired during COVID that actually were not able to keep going. But one of the big issues is that we have this supplemental funding, boom and bust funding, whether it was Ebola or whether it was Zika and now COVID. And so we make strides, we make 2 steps forward, and then we have to take several steps back when that funding goes away. So we need sustained funding for those core capabilities, and we need those authorities actually, whether it's with data or some workplace authorities, in order to do the mission that we're assigned to do.
Thank you. I look forward to continuing to support the work you all do at CDC every day to promote the health and safety of the American people and ensure our nation is equipped to respond to public health emergencies in the future. So thank you, and I yield back.